Preventing Cervical Cancer with Alternatives to the HPV Vaccine by Lily Homeyer. Besides the HPV vaccination, there are other options available for protecting oneself against cervical cancer. Some may be lesser known, but that doesn't mean they should be completely ruled out. I will be discussing the alternative methods for protection against cervical cancer, including Pap tests, VIA tests, microbicidal drugs, and other prevention methods to get a better insight on which option may be best for your daughter. So what exactly are some of these precautions to cervical cancer anyway? Well, one of the preventative measures that can be taken are getting Pap smears. According to the article Cervical Cancer Screening in Young Women, Saving Lives with Prevention and Detection from 2010 for the Oncology Nursing Forum, written by Jessica Mormon, who has a bachelor's in science and is a student attending school at the University of California, Los Angeles, and the Masters of Entry to Clinical Nursing program. Young women should have their first Pap smear 3 years after sexual activity or before they reach age 21, and continue to have the Pap test routinely every year. Warman then goes on to explain that if a female has an abnormal Pap test, any irregular changes in her cervix are monitored closely and treated at an early stage before it turns into cancer. It's also important for women to go in for a follow-up if she has an abnormal Pap test. This can simply be done by either a colposcopy or a cervical biopsy where the cervix is examined. It's very important to go in for a follow-up if a female has an abnormal Pap test. Cervical cancer has a very high survival rate, even if it is detected early at an early stage, according to Warman. If you decide the Pap test option is best for your daughter and she has an abnormal result, make sure she isn't too afraid to go in or embarrassed to go in for a follow-up. Another option to help prevent cervical cancer is the visual inspection with acetic acid, or VIA test for short. Unlike the Pap test, VIA can detect abnormal cells in the cervix so quickly that women that have a VIA can be treated within the same visit, so they don't need to come in for a follow-up. I read about this in an article by Doctor of Public Health Deborah Main and Masters of Public Health Sarah Herbert and Dana Greason. This eliminates any chances of women not coming in for a separate visit to have a follow-up, since the follow-up can be done during the same visit. This could be an option to look into if you don't have the time or money to come in for a follow-up doctor visit. As for the future, according to the article by Doctor of Medicine Joanna M. Kane and Doctor of Philosophy Mary K. Howitt, women may be able to use microbicidal drugs once they become commercially available. The microbicides work against the human papillomavirus to block and deactivate it. Although this may not be an option just yet, parents should keep their daughters informed about possible options such as microbicidal drugs for preventative measures that they might have available to them in the near future. In the article Stop Cervical Cancer in Its Tracks by Charlene A. Bentz, a registered oncology certified nurse, she recommends that along with these other methods for prevention, young women can help protect themselves from cervical cancer by avoiding the activities that can lead to the human papillomavirus. To do this, she suggests for young women to delay having sex and insisting on all of their sexual partners to use condoms. She also suggests that young women should quit smoking or not start the habit. After getting a better understanding about the various methods of cervical cancer prevention, I hope that you can make a more informed decision. Some preventative measures may be more appropriate for other situations than others. For more information on the different methods to prevent cervical cancer, you can look at the American Cancer Society's website at www.cancer.org. Thank you.